All right, moving on to yet another India Today impact. Days after we exposed, in fact, about how Ayushman Bharat Yojana had impaneled hospitals where either treatment was being denied or illegally charging of beneficiaries was taking place, the Punjab government has now issued a show cause notice to two hospitals that were shown in that investigation, JP Diagnostics in Zirakpur and Indus International Hospital in Dera Bassi. The Aam Aadmi Party government has directed both hospitals to explain why Ayushman Bharat beneficiaries were refused treatment, also warning that strict action will follow if their responses are found to be unsatisfactory. Remember, on this program just last week when we brought this news, the Punjab Health Minister had said that he will take action. This is what he had said. So the last report that you saw there, a doctor who owns one of those hospitals says very clearly that they already have a lot of pending payment coming in from the government, and which is why he simply cannot afford to run the hospital this way. If you look at the numbers as well, a total allocation of 9,406 crore was made in the union budget last year. It has already been increased by 29%. You know, budget is around the corner. We are expecting another increase to happen over there. A lot of this allocation goes directly to the states. I'm trying to understand, where is this money going?
I will tell you, the very scheme of the central government is faulty. You see, central government owes Punjab 300 crore rupees. When we raise the bill, they are supposed to give, it's a 60-40 scheme. Central government 60%, state government 40%. But they give us only, they say that we have a budget of 105 crores for Punjab. They have a limit. So they say it's a central government scheme. So they limit the budget, but they only actually pay us 20%. So all the states are suffering because of that. This scheme is like any other scheme. You see, smart city, you see the condition of smart city, Gurugram, Delhi, or any other smart city. So they announce the schemes with big fanfare, but they don't give the matching grant which should be there. How can they fix the budget? It has to be 60%, because so many people are covered with that. 16 lakh families in Punjab. Now we are going to give it to the entire population of Punjab, and we have already kept 1,200 crores for that. So the money does not come. Their portal was not working. So most of the problems are with the center, NHA. So states suffer because state has to face, we have to face the people when they come for treatment, but the money does not come from the center. So the problem
is, have you raised this issue with the center, sir? We're again going into Aam Aadmi Party versus BJP over here. Would you say this is the issue only with Punjab, or would you say this exists across states as well?
I am not saying that. I am saying that there are often delays. There are often delays, and the money allocated is much less than what is the share of the center. These are facts. I can give you the facts. I have met the Honorable Union Health Minister twice for this. I have written DO letters for this. I can share with you. You see, they told us to get the audit done for the previous year for the Congress's name.
All right, so that was the health minister over there. In fact, in the process of that interview, we did, highlight the names of that hospitals, and he said that he will take action. Very happy to see that that action has been taken. But remember, Ayushman scheme is much more complicated than that. The hospitals often complain that there is no reimbursement happening from the government, which is why they can't offer these services. But that's a story we'll take on another day.